Hi, I'm Dr. Ali Hushman. Rowan University is committed to educating the public about the importance of higher education in our state and region. That's why we are proud to support the important programming produced by the Caucus Educational Corporation.
State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by RWJ Barnabas Health, the Terrell Fund, supporting right from the start NJ, PSE&G, committed to improving New Jersey's economy and strengthening its communities. Rowan University, educating New Jersey leaders, partnering with New Jersey businesses, transforming New Jersey's future. Horizon Blue Cross Blue Shield of New Jersey. New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation. And by the New Jersey Office of the Insurance Fraud Prosecutor. Insurance fraud costs New Jersey families $1,300 a year.
Welcome to State of Affairs. I'm Steve Adubato, coming to you from the beautiful Agnes Veris NJTV studio here in Newark, New Jersey. We're pleased to welcome Josh Weston, Honorary Chairman of ADP and also the Chairman of NJTV's Board of Trustees, to fully disclose. Good to see you, Josh.
Nice to be here, Steve.
Every time you're with us, we talk about challenging, difficult issues, and you put out what you believe are some remedies. Let's go right to the healthcare crisis in this country. A lot of talk about replacing the Affordable Care Act, otherwise known as Obamacare. Your biggest concern about that is?
Well, I don't think that's the biggest concern. Let me back up.
Sure.
What Obamacare and other conversations are about is who pays how much of the bill for health care. The real issue is the bill for health care. This country spends $4 trillion a year on health care. To put it in perspective, that's $12,000 per person. That's about twice what countries in the Western world pay for their health care. And they live longer and they're healthier. So we spend twice as much in order to be less healthy than countries in the Western world. That's the real issue, not Obamacare or Medicare or Medicaid or who's paying the bill. If you want to know more, you have to ask me the next question.
I will. So why is it so hard to have an honest conversation about what you just laid out as the real or bigger problem?
Oh, it's a tough issue because it starts with how we handle health care. We are on a fee-for-service basis. You go to a doctor, he charges you a fee. You go to the hospital, they charge you a fee. Actually, it's not a fee. In each case, using software that's peddled all over the place, they explode the so-called fee into various components, put a price on each component, which makes the total fee a lot higher if there was just a fee. Adding to that, when you are in a fee-for-service mode, whoever is providing the service, say a doctor, has an incentive to provide more service, more fees.
Even if it's not necessary for the patient?
Or if it's questionable, and make it even worse than that. There are a lot of good doctors in this country.
Clearly.
You go to see your doctor is listening to you and then doing his best or her best. You probably visited some other doctors somewhere along the line. You probably had EKGs elsewhere. You probably had blood tests elsewhere. You probably had MRIs elsewhere.
Josh, I feel like you're talking about me right now, but go ahead. In case you're on target, but go ahead. I'm not alone.
Okay.
Add it
in
up.
any event, we don't have integrated health care. We have disintegrated or disaggregated where different entities do their thing. Now, in our country, we normally think that the marketplace is a good place. You have buyers looking at competitive sellers, and you pick the best. Normally, that's logical. Now go to health care. Who's the buyer? Well, the patient is the person who needs help. patient isn't paying for most of it. The patient isn't a buyer. If the patient wanted to know what it's going to cost, the patient is not in a position to decide what the patient needs. Only the doctor can tell him what you need. The doctor is the vendor. So now you have the vendor or the supplier telling the buyer what to buy. The buyer doesn't know the price. The vendor doesn't know the price. The payer, that's an insurance company, whether it's ACA or an insurance company, they come later. So essentially, when the transaction is set up, the patient has no knowledge or no incentive on what to buy.
What happens when we get that bill?
The bill doesn't go to the patient. He never sees the bill. The bill goes to the payer.
The insurance company, whomever.
Medicare. Now, they get this bill weeks after the fact. The bill says, the doctor says, I did A, B, C, D on such a date. Maybe the doctor did. Maybe the doctor didn't. There's no verification because the patient has nothing to do with it. I could go on and on.
Well,
but
if you were in charge, I often ask you the same question. You were the CEO of a very complex company, you helped build the company, but if you were the CEO, the king, no Congress, you could make the call. What would be the smartest solution?
The call I would make is already partially in existence in this country. It's called Kaiser Permanente in California, and here's how it works. The fancy word is capitated health care, but leave out the technical word. If you go to Kaiser Permanente, they tell you your annual premium is X. They have salaried doctors who don't get paid more because they did something extra for you. They own their own hospitals. All the medical information is under one roof. Each doctor who's on salary for Kaiser Permanente knows all the other specialists. And what they do is they take a look at all the diagnostics, decide what comes next. They do what they have to do. There's no extra charge. The patient has paid one flat annual fee.
That is a capitated, meaning it's a cap. There's a cap on how much you can spend.
Per capita. Yeah.
Got it. I got it.
Okay. Now, Kaiser Permanente is the biggest. Mayo Clinic in Minnesota, on a smaller scale, does that.
Doesn't the Cleveland Clinic do it as well?
Cleveland Clinic also does it. So there's three living examples. The biggest and the longest in existence is Kaiser Permanente, which is why I picked on them. And it's not easy to switch this whole country. Wow. But if I were emperor...
Yes.
Am I still talking?
Yeah, go ahead.
Okay, if I were emperor, I would tell any entity who wanted to start a Kaiser Permanente, the government will help you get off the ground as follows. We will give you an annual subsidy for each person you insure, say $1,000. So it'll give you some startup money to do what Kaiser does. Incidentally, there's no country in the Western world that operates with fee-for-service like we do.
Just us?
Just us. We're exclusively wrong.
So you would do it the way you just described it. Just 1 minute left. The Syrian refugee situation, you've talked to us this in the past. Where are we and what do we need to do?
We're in a bad place because it used to be Congress authorized 100,000 refugees a year to get refugee visas to come to this country. Trump cut it to 40,000 and wants it cut to 0. So honest to goodness refugees, most of whom are mothers and kids who don't look like a terrorist.
They just want to be here.
Can't get in.
Can't?
No, because they can't issue refugee visas. It's up in the air. It should be the same 100,000 a year. What's wrong with that? Canada, smaller country than we, they admit far more refugees than we do. It's ridiculous.
Give me a number. What do you think the appropriate number of Syrian refugees this country should have is?
Well, I think we could handle 200 or 300,000 because we're a country of 300 million. So if we admitted 300,000 refugees a year, good people, that means 1 out of every 1,000 Americans would be a refugee. What's the big deal?
You know, Josh Weston is not just the former head of ADP, helped build that company, but as the chairman of the board of NJTV's Board of Trustees, you provide us wisdom and insight. And I just want to thank you for being with us, Josh.
It's a pleasure to be here, Steve. I gave you suggestions. You make them work.
We're going to press some people to make it work. Thank you. Josh Weston's in the house. We'll be in the house right after this. Stay with us.
To see more State of Affairs with Steve Adubato programs, visit us online at stateofaffairsnj.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter at Steve Adubato.
We're here at the NJEA Convention in Atlantic City, 164th convention, and we are honored to be joined by the president of the NJEA, Marie Blistan. Marie, you taught for a few years?
Yeah, well over 30 years.
Where?
Yep. I taught in Somerdale in Camden County. I taught in Sterling High School, and then I went over to Washington Township in Gloucester County.
Why'd you get into teaching?
To help students. When I was in high school, I found that I loved history, social studies, and I loved the Spanish language, neither of which I'm certified in today.
Is that right?
But I loved it, and I started to think about going into teaching because I liked my teachers. And then a student from Italy came over into our high school, and I did not speak Italian, but he spoke no English, and he was struggling, and one of my teachers asked me, out of the blue, if I would help him. And I did, and I found I loved it. And when I got into college, and I went to Camden County College, I'm a proud graduate of the county colleges, I worked, and I got introduced in the summertime to students who were physically, emotionally, and psychologically challenged. It was called Camp Happy Times, and it was right in Atco, New Jersey. And I fell in love with those kids. And I switched immediately to stop thinking about teaching history and Spanish and teaching children, those children who I thought needed me most.
You know, fast forward a little bit.
Yep.
As the president
Yes.
of this organization with, I believe, 200,000
Yes.
members.
Yes.
Describe that responsibility.
It's huge. It's not just 200,000 members. It is 200,000 families. It's over 1 million children in our public schools, and it's their families. That's the responsibility I look at.
Is it personal for you?
Very personal, yes.
Why? How?
It's a passion. I truly believe that there is no greater profession in this world, on this earth, except for being a parent. Because of the impact that we have, the opportunity that we have to help shape someone's life, to make it better, and to make the world better. You know, often our members, we don't really see the fruits of our labor. We see them during that year, or even during if they're K-8 or through the high school. But they go on into life and into society, and they become and do all kinds of great things.
You know, the NJEA is such a powerful force. I was talking to your executive director, Ed Richardson,
Yes.
about this. Being involved in the political process is a necessity for the NJEA?
Absolutely.
Make the case.
Well, we are public employees, and as public employees, we depend on public funds, and those public funds are overseen by elected officials. And we need to make sure that we are the priority. Again, because I don't think that there is any greater charge in this earth than working with children and providing for them.
There'll be a new governor.
Yes.
Well, the show will be seen as we move into 2018. Phil Murphy will be the governor of the great state of New Jersey. You say what to that?
I say we are thrilled. He has come to us.
He was here at the convention.
He was here at the convention this morning. He thanked us. He talked about the great things that he was going to do because he knows that public education is the cornerstone of this democracy, of this country, and of this state.
Number one issue in 2018 from your perspective, on behalf of the teachers, the educators, public school educators in this state would be?
Well, I think first we have to make sure that we recognize it's not just teachers. 200,000 employees of our support professionals are as equal to us as the certified and the active, and don't forget our retirees. We have almost 30,000 of our retirees. So all the issues that affect them and public education will be number one.
Go ahead, I'm sorry.
I was going to say, Phil noted in his remarks this morning.
You're on a first-name basis with the governor. I just want to say that.
Certainly, yes, I am. Yes, I am. And I am proud to call him ambassador and now governor-elect,
Yes,
let me
ahead.
tell you. He noted that school funding was going to be right at the top of his list, and I absolutely support that. We've been underfunded over $9 billion, and that has a residual effect, not just in our classrooms, in our schools. When I saw arts programs cut, when I saw physical education cut, when I go into buildings, Stephen, I don't see a school nurse in every single building I am upset, I'm bothered when I see school facilities that have been underfunded and are falling apart. That is just unacceptable.
Because of economics.
Because of, absolutely. So when he puts that down as number one, $9 billion over these many years that it's been underfunded, I absolutely support him because I know that there are going to be a lot of residuals that are going to be seen right into our classrooms, our school buses, our cafeterias.
Let me ask you about morale of teachers. I'm curious about this. I mean, the teachers that we interact with in the public schools in Montclair, thank you, by the way, for everything you've done for our children. Unless I'm not reading it right, they pretty much seem upbeat, positive, love their job, but I know that can't be the totality of the profession. How do you fight against, dare I call it, teacher burnout?
Well, there are a lot of reasons for teacher burnout. And, you know, it comes down, again, to whether we're holding the profession as a priority in our community and in our state. Do they have the resources they need to get through the day? And I think, again, over the last 8 years, the attacks that we have been under, verbal attacks, attacks that were physical in that they withheld funding for our public schools, it starts to wear and tear on our members.
Excuse me, how about standardized tests?
Yes.
Add to it? No.
Add to it?
It
no, no, it's overused and it's abused.
Meaning add to the frustration for some teachers?
Yeah, absolutely.
Explain that to folks.
Because, look, again, I've been in the classroom well over 30 years. I've had kindergarten through 12th grade students over that time. There is absolutely a need and a place for standardized testing and for regular testing. What is the place? The place is to measure a student where he or she is at that moment in time, and then to use it diagnostically to see what else we need to do to move that student forward. It has taken a far right turn or a turn overused and misused, right? It's not the sum total of a student. We're not measuring on a standardized test a student's ability to play music or to draw art.
What are we measuring through these tests?
We are measuring,
in your opinion?
Well, we are not measuring students' learning on that test. That much I will tell you. That much I will tell you.
So what message is there for parents like myself, my wife? Like, we say, okay, you got to take the test. You got to get ready for the test.
Yeah. Well, that's why
it's got to be done. It's the law.
Well, until we change the law, right? Until we get legislators in place who understand what the place is of testing and are there to support this profession and to support their children.
But you're saying it's really not the best way to measure where our own kids, students, children are.
If it's being used as the only way, it is wrong. It is downright wrong. That's correct.
How much you love what you do as the president of the NJEA?
Steve, I am a teacher. My parents were, I was the only female in my family that went to college, that went to 4 years, got a master's degree. I was the first female in my family. My father came from an immigrant family over from Italy. So they were very, very proud of my teaching career. And whenever anyone asks what I do, the first thing I say is I'm a teacher. And I am equally as proud to represent the members in this profession and to be the president of the association. But I will also tell you that I teach every single day.
Always an honor and a pleasure.
Steve, thank you. Yeah,
thank you for having us here.
No, thank you.
Okay.
Yes.
To see more State of Affairs with Steve Adubato programs, visit us online at stateofaffairsnj.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter at Steve Adubato.
We are pleased to be joined by our good friend Debra Vizzi, who is President and CEO of the Community Food Bank of New Jersey, a great organization which is
the largest anti-hunger, anti-poverty organization in the state of New Jersey.
And I'll tell you, you make such a difference every day. We'd go through some stats.
Sure.
Debra and I were going through this. She's been with us many times, but these numbers are extraordinary. Nearly 1 million food insecure New Jerseyans. Almost 300,000 of them are kids. That's 1 in 7 children. Come on.
It is. It's really startling. And 50% of the people that are seeing us in food pantries and soup kitchens around the state have a working member in their family. So the needle has really shifted for us. Essex still has the highest food insecurity in the state of New Jersey, with Cape May following with the highest food insecurity for children.
Why?
Probably seasonal work. Also, they were very severely hit by Sandy. Slow recovery.
All these years later?
Yeah. Also, the casinos and the shift in the employment scene there is really changing access to food for kids. Big time. And then, of course, just having, Atlantic County be sort of the hub, but Cape May and Cumberland County really struggling.
By the way, as we were talking to Deborah, we want to put up the website for the Community Food Bank. People can volunteer, people can make a difference, people can help others in need.
Absolutely. I mean, we can't do this alone. I mean, this is a movement. And I think one of the things that we come away with every time we talk is that people do acknowledge that there's hunger, but they don't think it's in their community. I have
They're
a
wrong?
lot. Yeah. They're wrong. There is hunger and food insecurity in every county in the state of New Jersey. We are a visible, active movement in every county in the state because there are hungry people. I think the thing that we want to also address with New Jerseyans is that when they do donate, that they should be mindful that not everyone has access to ovens, places to cook, and that during this season of the year...
We happen to be doing this during the holiday season of 2017, the end of 17 going into 18. Go ahead.
Yeah, but this season, people are having to cook and then having soaring costs in utilities. That's something that we really are being very mindful of because people make really tough choices about that.
Well, it's heat or eat.
Absolutely. So, it's interesting because oftentimes we want to give produce, we want to give meats, but you generally have to bake them. And that really is very challenging for a poor family. And poverty is the #1 reason people are food insecure.
So what should people, sorry for interrupting, Deborah, what should people be giving?
High protein and things that are almost usable immediately.
Exactly.
Packs of salmon, packs of tuna, stews and soups really go a long way. It's something you can microwave. Being mindful that not everybody has an oven or access to an oven. A senior citizen who may have difficulty opening things and cooking things. So things that are sort of ready to eat are always more beneficial. But we keep telling people, continue to donate, volunteer your time, and pay it forward. You can do a lot in your own community. The senior down the street who needs a table. Holiday time, you can invite people over. Summertime, when you're seeing kids that are out for breakfast and lunch, and how you might be able to develop community kitchens right in your own home.
So it's not enough to say, oh, the Community Food Bank is doing all that.
No,
That's not a strategy. You are making a big difference, but the need is much greater.
It is much greater, and like I said, we cannot do this alone. I mean, we know that because 60,000 visits of volunteers every year tell us that we can't do it alone. We need their help to pack boxes, to send things out, to spread the word and to spread the message. I can't tell you how many people come to the food bank and say, I had no idea how big this was.
Right.
We're the
It's
size
huge.
of, we're the size of 5 football fields, just one of our sites. So our need is great, it hasn't changed, and we really need people's help.
What is the farmers market that you're involved in?
Well, we're really focused on health, right? You and I can go to a variety of supermarkets and pick organic vegetables and fruits and so on. We're popping up farmers markets all throughout the state to give families access to healthy choices, to be able to get produce, to be able to get vegetables. 25% of our distribution now is in foods to encourage, fruits, vegetables, other proteins that people need quickly.
Finally, this diabetes piece that you've been talking about is interesting to me. Connect that to food insecurity issues.
Yeah, a lot of folks that we're seeing in all of our centers have a lot of health issues that are challenged by nutrition. So if we can provide a diabetic box, for example.
What does that mean?
Meaning foods that are low in sugar, that are healthy for their health issue, they will have better health outcomes. And that is important to us because if we can prevent someone from going into the hospital or link them up with health care, that our goal is to shorten that line and to help them stay healthy.
In the time we have left, Deborah, I'm tempted not to ask you this, but I will. Public policy matters here a great deal. So my point is, decisions made in Washington, a new administration in Trenton with Phil Murphy becoming the governor. how much does it matter to the issues we're talking about?
It matters greatly. And, you know, we know that hungry people, regardless of whether they're Republicans or Democrats, we have to feed them. So we're a very apolitical organization, and we work with whatever administration is here to broaden the issue and help them understand what they can do.
You could be apolitical, but also be involved in policy.
Absolutely, and we are. We're very concerned about SNAP benefits. We're very
SNAP, to make it clear.
Yeah, basically the cuts that we're seeing from the federal level on SNAP and the after-school programs that will be affected. You know, those are things that are very important to us.
Real quick, before I let you go, there's an initiative with the Summit Medical Group Foundation. It's a pilot program. What is that about, real quick, 30 seconds?
Again, it's about the diabetes, and they're basically partnering with us to test people in the pantries, in soup kitchens, determine who has a diabetic condition so we can best treat them, hook them up with medical care, give them the right food, because food is a prescription.
How hopeful are you?
I am very hopeful. I mean, I can't go to work every day not knowing that I make a difference in someone's life. And I think all of us at the Food Bank really believe that we're making a dent for someone every day. We all have problems, but the person who's food insecure only has one, and that's that they're hungry.
You know, in the few seconds we have left, one of the things that strikes me about you, Debra, every time we talk, New Jersey is lucky to have you, but
thanks.
I will say this. It isn't just on the Community Food Bank. It is on all of us, and that's why we need to continue not just to cover this, but to continue to try to make a difference. I thank you for joining us on State of Affairs.
My pleasure.
Thank you.
Always.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by RWJ Barnabas Health, the Terrell Fund, supporting right from the start NJ, PSCNG, Rowan University, Horizon Blue Cross Blue Shield of New Jersey, New Jersey Sharing Network, and by the New Jersey Office of the Insurance Fraud Prosecutor. Promotional support provided by the New Jersey Business and Industry Association. And by New Jersey Monthly, the magazine of the Garden State, available at newsstands.
Think this is absurd? Insurance fraud costs every New Jersey family over $1,300 every year. Report fraud at njinsuраncefraud.org.